In today's fast-paced world, keeping up with the latest medical knowledge can be a challenge, especially for healthcare workers striving to provide the best care possible. Introducing the Clinical Care Platform, a proudly South African, wholly owned online subscription edutech built for healthcare professionals. Our mission is simple: to improve patient care by increasing access to high-quality, evidence-based educational resources, anywhere, anytime. With our membership subscription, you gain unlimited access to a growing library of over 155 CPD accredited courses, weekly micro lessons, and 10% discount on paid e-learning courses, all curated to align with local and global guidelines. Join live webinars, over 160 sessions and counting. Earn CPD points on your schedule, and download key clinical resources, including templates, research reports, and practice guidelines. Subscribe, get educated, earn CPD points. With the Clinical Care Platform, lifelong learning is just a click away.
Missed our latest webinar? No worries. We know life gets busy, but your professional development shouldn't have to wait. That's why we've created webinar micro lessons. Short, focused recaps of our full sessions designed to help you catch up quickly and still earn your CPD points. These bite-sized lessons are available exclusively to active subscribe members. So even if you miss a live session, you never miss out on the knowledge or the CPD points. Not subscribed yet? Now's the perfect time to join. Get access to all future webinars, every micro lesson, and more. Visit www.clinicalcareplatform.com to sign up.
Welcome to today's information session in Diploma in Obstetrics and Gynecology and Internal Medicine preparatory programs. This session introduces two key preparatory programs developed to support medical officers and general practitioners in advancing their clinical skills. The Obstetrics and Gynecology program enhances knowledge and skills for safer maternal care. A CPD accredited advanced certificate is awarded upon completion. The Internal Medicine program supports postgraduate development with live webinars, case-based learning, and access to current clinical protocols. Both programs are tailored to the real-world needs of clinicians and aim to build practical, evidence-based competency. We look forward to sharing more about these opportunities and how they can support your professional development. Thank you for joining us. Let's get started.
Aibu. Good evening, colleagues, and I hope you are well. Welcome to the Clinical Care Platform, and we've been doing a series of these information sessions, and I'm hoping that you are ready. What are you ready for? Well, to grow yourself, because most of us, that's how our careers go. We do the super undergrad. You know what is the super undergrad? Grade 1, grade 2, or if you are like me, sub A, sub B. Then you get to matric, which launches you, to your sort of chosen profession or career. And usually after that, we struggle, to find ourselves, to say what's next, and we have to keep growing. And as a platform, we have made a commitment to make it very easy for you to continue to be a person who is growing. On your side, you have to commit to grow intentionally. That means you have to make the commitment, make it public, choose one or two areas that you really want to grow, and commit some hours every single day. A minimum is an hour, preparing, practicing, reflecting, preparing, practicing, reflecting. If you go through this cycle every single day, today won't be like tomorrow. Next month, you'll always come out better than this month. And it also means next year, you'll be a way better person than you were this current year. So this is all we are all about here at the clinical care platform, and we are doing it purposefully because at the heart of the goal as a platform is to improve patient care. So we want you to have goals to develop yourself, but the ultimate thing is to ensure that every single person who comes to us when they are at their greatest need for their health, they find us ready, they find us confident, and they find us to be very, very competent. So that is what we are all about. I did have a talk around growth, and I said there are certain growth traps. I don't know if some of you were there in that leadership webinar. Things that you have to be aware of, like let me think, what the assumption gap or prison, where people think that I will grow, I'll just become better, it's going to be automatic. Unfortunately, it's not like that. There's no automatic. The only automatic growth happens when you are a child and you're becoming an adult. After that, it's going to be very difficult. You have to make that decision and commit yourself intentionally to go. The perfection gap. Do you guys remember the perfection gap? It says, I'm waiting to find the right way to grow. No, there's no right way. The only way to figure out your next step is to start. It's like if you are driving and you don't know the road, it's an unfamiliar road and it's at night. Well, you can only know the road as you go. So you don't say, no, let me figure out the road first, then I will win. Let me think of two more gaps. The comparison gap. Ooh, Dr. Mawela does it so well. Ooh, Dr. Ryan is so good with this teaching. I can never do it the way he does. Well, I want to tell you something. He had his day one, Dr. Bawela. Dr. Ryan Swepesat had his day one, right? You are comparing yourself in a particular skill or field with someone who has already been through the journey. There's no need to compare yourself, just start. And the last one, because it just came on top of my mind, the timing trap. Remember the timing trap? Who remembers? The timing gap. I'm waiting for the right time. I can tell you. You're waiting. I'm waiting for things to slow down. Hey, we are health workers. Life will never slow down. Our life, it's busy. And whenever it slows down, it's probably time for family. It's probably time for yourself. It can never be the right time for you to develop yourself and to grow yourself. The only right time we have is today. Ne? Today. That's why you must just do it. So if you have made up your mind that I want to grow and be better next year, this time, I want to develop my skills in internal medicine, I want to develop my capability in obstetrics, please, there's no tomorrow. You start today, you register, you get your books. You know how we do it. And luckily, you have support. You're not going to do it alone. As a platform, we have created an environment which will support your growth plans. So you must have a growth plan at any given time where you find yourself. All right. So on that note, I'm going to welcome my dearest brother Ryan Swepesat. You call him doctor, but me and him, we have a matured relationship. So yeah, I know. Besides him telling you about this diploma coaching program, he's gonna leave you feeling good about yourself because I really, really, honestly do enjoy.
Hey, Brother Mawela, I lost the audio.
Oh, my audio is gone. Okay, yeah, because I was
Oh, there
trying.
you back. You
I
back.
was just
You
trying to
back.
check who's here because I can't see Billy. So I will also reach out to him. But on that note, let me just say thank you so much, Brother Ryan, for this partnership. And I thank God, really. I don't know how we got to connect, but so far things have been so good. So may we continue to love this relationship, to nurture it, and God continue to bless it so that more and more health workers achieve their potential because of the value we add in their lives. All right, I'm speaking like a pastor today, but I'm hoping it's all
Amen,
good.
brother.
All right, colleagues, let me hand over to Dr. Raitsui Pesat to take us through. Thank you, brother.
Thank you, Brother Mawela. Good evening, everybody. Thank you for those very warm words, Leseko. I see that you really you in the motivational mode today. Yeah? Monday motivation.
Hey, yeah, we must start the week on a high note.
Absolutely, absolutely. Thank you, brother.
Welcome.
Good evening, everybody. Thank you, bro. Let me just get my pointer in here. Yeah, good evening. Welcome. Thanks for joining us. I'm not sure how the weather is wherever you are, but in KZN, it has been a very rainy day. As they say, Liana. It's been raining the whole day. But I hope that you and your family are well. God bless you and thanks for joining us. Okay, so we're talking about diploma internal medicine. I just want to draw attention to what Sir William Osler said many moons ago. He said the good physician treats the disease, but the great physician treats the patient who has the disease. You know, being a doctor is a calling. And beyond just looking at pathology, we need to look at the patient who has the pathology and treat that patient in their microenvironment. And that's what we're hoping to do via the diploma. And to kick things off, I'm trying to shake things up a bit. So I want to give you a case scenario, right? Let's just go through this. Mr. Ndlovu is a 34-year-old
Hey,
male,
Patty.
single, employed as Brother Bawela, employed as a chartered accountant at Discovery, non-smoker of sober habits, no known comorbs. Now he comes to you because he noticed that he thinks, Doc, my skin has become tight and thickened over the last 6 weeks. He has Raynaud's phenomenon. If you're not sure what that is, it's a triphasic color change in the digits, white, blue, red. He also has joint pains involving his wrists and elbows. He went to his GP who said, you know what, let's put you on some prednisone. And he has been taking prednisone for the last 2 weeks. Oh dear, but we don't know what we're treating. His joint pains have settled, fantastic, but what's going on? He has been having headaches for the past week. No fever, no photophobia, no neck stiffness, very significant negatives. He also reports intermittent blood vision and is what he looks like. Have a look at this particular dermatoses, this rash. Look at the fingers. Look at the changes on the fundoscopy. All right. This is the real case, by the way. And then you go on to do some investigations. You find that he has a white cell count of 6. He's a bit anemic with a thrombocytopenia. And on the smear, you see red cell fragments, otherwise called schistocytes or helmet cells. But there's no platelet clumping, but the platelets are reduced in number. He has renal impairment. And his UNE was normal 3 weeks ago, but now he's looking at what looks like acute kidney injury with normal inflammatory markers, although ESR slightly uppish. Lactate dehydrogenase at 1500. Then we've got a couple of some weird antibodies here. Anti-scleroderma 70 being positive, anti-nuclear antibody positive at a titer of 1280. Excuse me, anti-RNA polymerase positive. Look at this blood pressure. Oh my goodness. 220 systolic over 110. What do you think about that? And the urine dipstick is 2+ protein with no nitrites. All right. Now I've got a couple of questions coming up now. What is going on? Let's take your submissions in the chat group. Right. So this is just like flavoring things up here. Let's take your submissions. I'll read your submissions as we go along with the talk as to what is the diagnosis here. All righty. So obviously we're going to break it down, right? So why the Diploma Internal Medicine in South Africa? Well, the purpose of this is to encourage postgraduate training in internal medicine, like Brother Mawela mentioned. Undergrad is like the ABCs, the 1, 2, 3s. And for those of us who deal with internal medicine on a daily basis, whether you just have a flair for internal medicine or whether you're working in the Department of Internal Medicine, whether you want to get into the registrar program, this is for you. It's intended for medical officers in both teaching and non-teaching hospitals. If you're working in district, not a problem. If you're working in the clinic, not a problem. It's designed to improve your ability to evaluate and to manage common medical disorders. And this will eventually lead to improved medical care, both in rural and urban communities outside of the larger training centers. What are the core competencies required? You should be able to evaluate and manage common conditions. And this program is designed to help you to do just that. Should be competent in the performance and interpretation of certain procedures, including things like central lines, okay, biopsies of lymph nodes, pleural biopsies, liver biopsies, bone marrow aspiration, trephine, lumbar punctures, okay, and that kind of thing, intercostal chest drain insertion. You must be able to judge when to seek help from a specialist. So a good doctor always knows their limitations and should know when to refer for help. Okay, I should be able to know when and how to refer to regional and tertiary training centers for specialist or subspecialist consultation. So this course is designed to empower you to do all of the above. Well, of course, the procedures you have to learn practically, uh, but it's designed to empower medical officers to supervise and train interns and ComServe doctors as well. What are the requirements for admission to the program? Well, you've got to be registered with the Health Profession Council as an independent practitioner, and you should undertake at least 12 months, but I think it's 6 months. They do accept you at 6 months of full-time in-service training in the Department of Medicine at a hospital accredited by the college and or the HPCSA. Okay, you may apply for the exam after having completed 6 months of training. Okay, but for coaching, for the intents and purpose of this particular program, anybody can apply. Even if you're somebody who's not looking to write the exam, but you're just looking to sharpen your skill set or sharpen your ability in internal medicine. So it's open to medical officers, to general practitioners, to registrars, to physician assistants, to community service officers, to interns, anybody who wants to just sharpen their skill set and their acumen in internal medicine. But for those of you who are keen to do the exam, to add that to your CV, how is the exam structured? Well, there's a written component consisting of 2 theory papers, there are 2 theory and 1 OSCE. Okay, so papers 1 and 2 are the theory. They will be of 3 hours each, and they are clinically orientated and based upon clinical scenarios, short answer clinical scenarios. And there's 10 equally weighted questions per paper, and the emphasis will be on short answers. Then paper 3 will be an OSCE, where they give you a variety of data to interpret. So ECGs, chest X-rays, blood gases, lung function tests, bone mineral density scans, okay, things like that. And that will consist of 15 questions, which will be equally weighted. Now, if you pass this, then they will invite you for the clinical component. And yes, I do include a session where I'll be coaching you on key ways to present patients and tips on how to do that, and common cases that do feature in the exam. Okay. And that clinical component emphasizes history taking, examination, and clinical assessment. And that consists of 1 long and 2 short cases. I think that it's now 3 short cases. So I think they have revised the format of this. And yeah, that's the clinical assessment. Okay. So in terms of the theory papers, we said there's paper 1 and paper 2, equally weighted questions of 10 marks each, short answer style. And those 20 questions are subdivided as per the different disciplines in internal medicine. So obviously, some are weighted a bit more heavier than others, and that's exactly how we partition or structure our program. So, for instance, cardiology, we have 2 questions. You will spend 2 evenings speaking about cardiology. Likewise, emergency medicine, endocrinology, metabolism, infectious disease, nephrology, pharmacology, pulmo. And then for others like GI, geriatrics, nutrition, hem-onc, neurology, and rheumatology is not as heavily weighted. So we'll be allocating just 1 evening discussing those particular topics, okay? And the OSCE is 15 questions. Like we said, a lot of data to interpret. So your ECGs, your chest X-rays, your lung functions, your blood tests, your CSF analysis, your urine results, your stool, your ventilation perfusion scan, lots of pictures with clinical signs and rashes, etc. And included in this workshop, we have 2 intense masterclasses, one on ECGs and one on chest X-rays, which will be incorporated into the package. All right. So our course structure is 20 sessions, twice weekly. When do these sessions happen? Once on a Tuesday, the other on a Friday evening. The Tuesday session is from 8 to 10 p.m. and the Friday session from 6:30 to 8:30 in the evening. These are very high yield. They are system based. They are CPD accredited. So you're going to cash in on your CPD points. And the way I structured these sessions, these are based on past year questions. I'll give you some examples shortly, right? And it's designed to equip you with the necessary information you need, as well as empowering you with an approach to answering the questions, and not just for the exam, but also for dealing with real life scenarios, with real patients, with real pathology. Okay. We will incorporate relevant OSCE questions and investigations as well. So this is the way we planned it out, okay, October, November, December. And we will obviously have some sessions in January as well, just closer to the exam itself. And this is the way we're certifying the approach. Like I said, the more heavily weighted disciplines as per the blueprints, we'll spend more time on those. And Brother Mawela will be helping us with one mega session on HIV and TB as well. Okay, and like I said, there's 2 workshops, ECG and chest X-ray interpretation. Let's look at an example. Okay, let's have a look at the chat. Is anybody mentioning? Oh, okay, so we have one submission. Autoimmune disease likely scleroderma. Hey, Namonde, we got a physician in the house. The obstetric session is still yet to happen, brother. Okay, so this is an example. Let's go. 40-year-old female comes to the clinic with shortness of breath, and an echo reveals she has pulmonary hypertension. Give a classification of pulmonary hypertension with examples in each group. So this was actually a question that did feature in the 2017 paper. So I take you step by step through the WHO classification, the 5 different groups, okay? Idiopathic, group 1. Left-sided heart disease, group 2. Long-standing hypoxemia, group 3. Chronic thromboembolic phenomenology, group 4, and then miscellaneous, group 5. And then I also have some fun cartoons to kind of spice things up, because I believe that learning through pictures is very powerful and really helps the information to stick. And then we go through some detailed pathophysiology. Okay, and then I take you guys through examples of investigations. Like this is the typical ECG showing sinus tachycardia, S1Q3T3, right ventricular strain pattern. Findings on chest X-ray, okay, that suggests pulmonary hypertension. Having a look at some echoes as well. Okay, and then I take you step by step through the management and the treatment approach, okay? So obviously we'll get into that during the program. So everybody, this coaching program is designed to be high yield, comprehensive, engaging and interactive, and very effective in preparing you not just for the diploma exam, but for real life as well. This is a small snippet into the chest X-ray masterclass, which is included in the program, where I take you from A to Z of chest X-ray interpretation. And then, of course, we have the ECG masterclass as well, the same with ECGs, where I take you from the basics to the more nuanced interpretation. This is an example of a slide taken from that particular program. Okay, anatomical localization, looking at different vascular territories and how to interpret this in the setting of ischemia and infarction. All righty. Yeah, so everybody, and of course, I love my dad jokes. Like, ever wondered why the Backstreet Boys make such bad cardiologists? Well, they'll tell you that it ain't nothing but a heartache. Tell me why. So I just told you why you should enroll in the diploma internal medicine. Brother Mawela.
Awesome, Brother Ryan. I had a huge belly laughter. Now my heart feels so good. Thank you,
Glad to hear, brother.
colleagues. Yes. Yeah. So, yeah, colleagues, that is Dr. Ryan Swepesat. He's our in-house physician. He's also a diplomat himself, so he has been through this journey. I'm gonna just pose one question to you, Brother Ryan, and then we move on to the obstetrics presentation. Then we have a quick discussion together, and then we call it a night. I wanted to ask you, yes, many people are joining to write the exam. But I was just thinking, there are interns, there are ComServe kind of people. Maybe I'm starting my rotation next month in internal medicine. How can this program benefit me, as I'm heading into my, I don't know how many months now. Is it 4 months? Internal medicine, I don't know. I stayed there forever. I refuse to move. They even called a meeting. I told them I'm tired of obstetrics and these things. But eventually they allowed me to. But this is long time ago. Brother, any
Yeah,
benefit for the young doctors?
absolutely. Okay. So, we're going to be seeing a lot of internal medicine in our careers.
Hmm.
And I know some of us do have a flair to become physicians. So this program is designed not just to prepare you for the exam, but to help you to become the best possible physician you can be. So I've cut through the clutter and I've made this as case-based and as high yield and as stratified as you need it to be, right? So that's going to make you really, really sharp when it comes to your clinical acumen. You'll be able to pull out the essentials from your memory and make that applicable to your patient. And you're going to give them cost-effective very, very effective guideline-based management. So it's going to make you that much more confident. It's going to improve your CV that much more. And overall, most importantly, it's going to impact patient care positively. So this is for anybody, interns, ComServes, MOs, GPs, physician assistants. If you love internal medicine, this is for you.
Awesome, awesome. And when you wrote your diploma, Ryan, how easy was it? And I don't know whether you wrote it when you were already a physician or before. So take us through the preparation and how it went and how you felt during the exam, and maybe the impact this kind of a program could have had on your preparation. Yeah.
Absolutely. So, brother, when I wrote this, I did it in 2017.
Mm,
And the thing is, because it's just so broad and so vast, I
mm,
mean, the recommended resources were Harrison's Principles of Internal Medicine and Talley and O'Connor and the Oxford Handbook. Now, if you look through those three resources, there's just so much of information. And
mm,
remember that that also is not stratified towards a South African context.
mm,
That is written by physicians in the States
mm,
and in Europe. Okay, and the pathology is somewhat different. So a program of this nature cuts through the clutter, giving you exactly what you need in a little takeaway doggy bag, you know, to make it relevant and to make it streamlined. And I wish I had this program when I did the diploma, but
mm,
it's available to you guys. So God
mm.
willing, you should grab it. Grab it.
Yeah, yeah, yeah. I had a similar journey, very difficult, and I was in a rural hospital, and I had to travel to Joburg almost every Monday to get the support and to be tutored own cost.
Mm,
So it was not necessarily a very affordable process. Yeah. Thank you so much, brother. We will come back to you. There was a question about paying in installments. I need help. Yes, send us an email. The team knows how to help and to support you. There's actually a number of ways that you can try and handle that. Number one, as you pay on PayFast on the link for paying, there are payment options. There is Mobi credit there. I don't like people taking credit to study, but it's an option you have. You'll get feedback in like 2 minutes if you are approved, you know. So they will then pay CCP and then you pay them maybe over 3 months or 6 months. But the team as well internally here at CCP, just write us an email, info@clinicalcareplatform.com. Lebohang, Ria Leboga Munedi is responsible for the billing. She has helped people before, and I don't see how she cannot help you as well. So if you feel the fee is a bit too high, you have other commitments, but you are able to commit to maybe, I don't know, paid in 3 months, whatever the issues are, just drop an email. You'll see how nice and friendly the CCP team is. On this note, I'd like to welcome Dr. Billy Magagula as well. He is another colleague, another friend. We come a long way. In the early days, I was the mentor. Tables have turned. He's the mentor. So, but I don't know if whatever he's mentoring me on, it's something I will ever. I don't know if I'll ever practice it, Dr. Magagula. Obstetrics, we have a. I don't know. I can't describe the relationship properly, but I don't think it's a relationship where I end up being a specialist or anything like that. No.
No, I think I'm failing dismally in my mentorship.
No,
Mentoring.
no, the mentoring is not failing. It is the choice of the
Yeah,
mentee. You see, the
that's where
mentee you
the problem
chose.
is.
That's why one of the things
Very
is to get
important.
the right mentee. But now you got
Yeah.
me. It's not going to go where we want it. Yeah, can I hand over to you, brother? Welcome, colleagues. He's an obstetrician. He is a double diplomat as well in obstetrics and HIV medicine, and he's doing his subspecialty in gynae oncology. So it's Bonabo Figo, Baba. We don't want to go to Figo conference. It's too big for us.
Don't worry. This is where we are. Evening, colleagues. Evening, Brother
Welcome.
Ryan. I always enjoy the jokes. It's always, awesome to listen to you speak. So I think that was very powerful, man. Much appreciated, brother.
Amen. Amen. Hi, Dr. Willie.
Are you good, brother?
All good. Hope you are too.
Yeah, no, I'm well, man. Thanks. Yeah, it's always nice to listen to you speak. I wish we had a lot of time because us in obstetrics and the physicians are like like that.
Yeah, cardiac in pregnancy. Those
Aye, bro,
things.
everything. Obstetric medicine is just so huge. So
Yeah.
huge respect for what these guys do for us.
All
But
right.
I don't know, should I continue, Alice?
Yes, you can take us through. Thank you.
Okay, awesome. Yeah, evening, colleagues, and thank you again for making the time. I know we're all very, very busy, but I'll just be sharing, what the Diploma in Obstetrics preparatory course is all about. So the purpose really is for us to share the skills, to share the knowledge, so that we are all comfortable in terms of looking after the pregnant woman. Okay. So obviously, if we have all those skills and the knowledge and the understanding, that will filter down to us having better outcomes wherever we are. So I think really that's the whole purpose of the program, to make sure that we improve on maternal morbidity and mortality, to improve on perinatal outcomes, but also capacitate colleagues to be comfortable looking after obstetric patients. I remember when I was a com server, down there in Sabi, nobody wanted the labor ward. Everyone, preferred all other wards except the labor ward. So I think it's probably the whole issue of the skills, the stress that comes with a job, etc., etc. So we want colleagues to not be like my former colleagues where I worked, and we actually have a special interest in colleagues who are in the periphery, in primary healthcare, as well as medical officers in district hospitals. And those colleagues that are doing sessions, in the labor wards, I think they stand to benefit the most. So in terms of who qualifies to write, this is according to the CMSA, medical officer who's at least 6 months post-internship qualification. So which means that as a com server, you can actually write the diploma in obstetrics exam. And then if you're in a teaching hospital, you must have been there for at least more than 6 months, or in a satellite teaching hospital. If you are part-time, so those colleagues that are doing sessions in the district hospitals, in the obstetric units, if you do at least 15 deliveries per year and at least 15 Caesars that are being performed per year. So you must be actively involved in performing these Caesars. And for those colleagues, furthermore, in terms of the district hospital MOs, actually there's an error in the previous slide. This is for the district. Oh yeah, no, actually it's not an error. This is the sessional people, and then this is for those that are full time in the district hospitals. You must have been there at least 2 years, with at least 400 deliveries per year and 40 Caesars per year, 20 of which must be performed by the applicant. And then you must have a reliable audit that must be confirmed by your superintendent, and you must also participate in your referral hospitals M&M. So the purpose of the program is to basically guide your learning, to give you access to experts in the field, which is myself included, and Dr. Valerie, who's about to become a fetal specialist. So she's, easily accessible to us. We are very appreciative of that, and other colleagues that we bring into the program. And we also offer continuous clinical support. So as to how we do this, we've got weekly live coaching sessions. So you will have a live coaching session, and then you'll have a self-learning session during the week, which is also guided. We've got lectures, presentations, skill trainings, access to the library and the community, etc. So as I said in my introduction, that yes, we want colleagues to have the diploma because it's very good for you. It's good for your CV, and if you are going to look for a registrar post, you are going to be in a better position, if you have the diploma in obstetrics amongst all your other diplomas, HIV, medicine, pediatrics. The more papers you have, the better the chances of you getting that post that you're looking for, or moving up the ladder, in your organization. Just to share some of the successes, of course, colleagues have said they are happy with us sharing this. These are some of the messages that we've been receiving from colleagues that are very happy and excited and giving us feedback, about their success. And we do not take ownership of this success. We are just, partakers. We just guide and support. But the colleagues put in the work, they put in the effort to study, to prepare for the exam, and we just guide to say, when you study, hypertension, this is what me as an examiner expect you to know and understand. If you study diabetes, this is how I expect you to understand it. And I mean, they go on to succeed. So yeah, I hope this will also be a story for some of those that will be writing the exam. And if you're not writing the exam, I can tell you that this program will help you a lot in terms of improving your skills, and your ability to look after obstetrics patients. That is it from me, LS. Thank you, colleagues.
All right. I hope you can hear me. Bill, how's my volume on your side?
It's good, brother. It's good.
Yeah, even yours is good because I was helping Karabo here, struggling with audio. Yeah, Karabo, apologies. I think, I don't know. It must be something there. Maybe check your Zoom audio settings. You might need to increase the system volume to a bit up. I don't know.
Brother, we lost your audio.
Oh, thank you. Yeah, I'm just
Hey,
switching
back,
between
you're back.
the stuff. And there's an old question there, but it was for you, Bill. You see, it's a question about pumps. Yes, I don't know it's from which way. It's from
Okay.
which way, Bill, and there. All
Yeah.
right, colleagues, we have our instructors here, Dr. Billy and Dr. Swepesat. But when we are three, you know what they call us? The three musketeers. So Billy,
Yeah.
Ryan did share his experience when he was pursuing his diploma. So can you just share your story? When exactly did you do yours, and what effort did you have to put in? And
Mm,
also during the exam, how was the feeling? And maybe
yeah.
if there was a program like this, what would have been the impact? I know you can't get a distinction twice, isn't it?
Well, unfortunately, I didn't get it the first time even, but I passed anyway.
Yeah, you needed this program.
Yeah. No, but for me, I did my internship at Rob Ferreira, so it's here in Nelspruit. And for my ComServe, I went down to Sabi. So I had an interest in obstetrics, obviously. So I actually wrote it when I was at a district hospital running the maternity unit there. So
Mm,
I needed to go and visit Rob Ferreira, which is our referral institution, with a specialist there,
mm,
attend their meetings, their ward rounds. So one needed to, to commute between the two frequently until I could get the recommendation letter. But the painful thing for me was that, I had that obstetrics in South Africa book. And my goal, and this is what I did, I read that book from the first page to the last page. Now that was very, very painful. It's a lot. And
yeah.
as Ryan said, to say there's a lot of content that is there in these books. But of course, it's important. But there are those things that you just need to know for you to practice safely, but also to pass the exam. So
Mm,
this is what these programs I think they are offering. So
mm,
I crammed that book from the start to finish. I even knew it word by word, and then I went to write the exam, and by God's grace, I passed, of course. But
mm,
it was a lot of effort, without guidance, without anything, literally by myself.
mm,
So it was cool. So a program like this, I think it's really, beneficial because not only do you get to know the theory,
mm.
but a lot of skills, how to do things and yeah, practical things that help you.
Hey, no more
Yeah.
Billy, please don't scare my colleagues away. No more just say Cho. So now I'm thinking, hey, you are scaring people. Please.
No. But that's why we're here, because we're here to say you don't need to read that book from the start to finish. You need to
Yeah,
know what is key to understand as you go to the exam. So it's
yeah.
actually less stressful than it sounds.
No. Thanks for that. Brother Ryan, so colleagues, also for you to note that obstetrics and internal medicine, they are at the same age. We are now going for our fourth cohorts. So they are quite matured. Obviously, HIV is the big brother, but
Of course.
but they are quite matured and
Yeah.
compared to the other programs that we are running. But brother Ryan, I had noticed with your third cohort, just the previous cohort, towards the
Yes.
end, you did a lot to prepare. We did the theory, and even in the theory, you always use case studies from the previous exams. But I saw you taking colleagues. I think it was the last session or the last two sessions through a series of Q&A. Why did you do that, and what impact were you hoping to achieve with that in terms of preparing our colleagues? Yeah.
Yeah. Brother, patients don't read textbooks, unfortunately. And the format of the exam is clinically orientated.
Yeah.
Even if you look at the theory, it's in
Mm,
the form of clinical cases.
mm,
So you may know a lot of theory, but unless you contextualize it in terms of a clinical scenario,
mm,
you might not answer to the best of your ability for the marks allocated.
mm,
So that's why I did that session marrying the clinical with the theory. And also for those chaps going for exams, the clinical exams as well, to
mm.
prep them in terms of approaches to those same patients. So I think
Yes.
that's also the missing link sometimes when you're
Mm,
preparing for an exam like this. You know the
mm,
theory, but you can't contextualize it. So
mm.
that's why we did it that way. Yeah.
Yeah, on point. Because we did the survey, the team is just preparing the report, and we're gonna call everyone at CCP, including our instructors, for the team to present what the colleagues were saying. So for the clinical exams, particularly because HIV, is just one exam. Unlike obstetrics and internal, there's like a series. So many people do pass the first phase, and then now they have to go for that clinical, or I don't know, OSCE, and then they feel a little bit like challenged a bit. Billy, I saw you coaching people via WhatsApp and putting scenarios there, even pushing them to say, listen, this case is yours, please reply. Tell us about that and what we can expect going forward. Yeah.
Yeah. No, I think as you go for your oral, because the written part we cover it thoroughly, during the coaching sessions. We actually have to now start the oral prep for the current cohort, the third cohort. So it's important for us to show real, I mean, how to continuously engage with the
Mm,
colleagues. So I just find it easy to put a case scenario, and then they all work on it, but
mm,
someone needs to give us a response and correct it from there. We get to do a lot more over a short space of time
mm.
rather than schedule regular meetings. I think that works, and I think the colleagues appreciated that a lot.
Awesome, awesome. Brother Ryan, this one is yours. The number one reading source. I know you share a lot of sources, but
Yeah.
is the priority source.
Yeah. Am I allowed to divulge this information, or should we register first for the diploma?
Nah, it's okay.
No. My number one go-to book is a title called Approach to Internal Medicine. It's a Canadian textbook actually. I love it.
Yeah.
It's jam-packed with the recent guidelines. It's not a very big read. It's only about 400 pages, but it has the most recent guidelines, it's acronyms, mnemonics, clinical scenarios. I love it. And if you join the program, it's
Mm.
yours. I'll organize a PDF.
You see people who love reading. It's not a big book. It's just 400 pages. I'm like,
400 small pages.
is it tonight? Tonight. Look at Nomonde there. No, but I didn't mean the sauce. Now you're thinking Nando's sauce and other things. Don't do that. um, I think Karabo asked Billy when you were presenting, what's your textbook? I don't know textbooks. You said you read
Yeah.
some big book page by page.
You know, the one that is just an easy read, you know, the obstetrics in South Africa, whichever version you have.
Mm,
But textbooks tend to be a bit outdated, so
mm,
you always want to see and learn if there's new things.
mm,
So especially if that publication is a bit older, it's good to, you know, support it with some review articles. So that's what we
mm,
may bring time and again as we go through these topics. But obstetrics in South Africa, that's like your starting point.
mm,
Then you move from there.
mm. So just to clarify, internal medicine, the dates are Tuesdays and Fridays. You know, now there's many diplomas. Now I get dear Bekar, but it's Tuesdays and Fridays. And Tuesdays it will be 20 hours, and then Fridays it will be 6 o'clock. Right.
Yeah. Yeah.
Obstetrics, you have the module is different. It's like the HIV diploma. You get weekly pre-reading materials, and then you get a single coaching session on Mondays, ne? Billy? Most of them are Mondays. And towards the end, you start to get Mondays and Thursdays, you know, and you must be agile as it changes. And you might be called as well for weekends to cover things like ultrasound or implants. So there's a lot of skills things as well. And talking about skills, Brother Ryan, the colleagues need to know if you join the Diploma Internal Medicine, you also get 2 skills programs, live coachings on Saturday. This would be the chest X-ray masterclass and the ECG masterclass. Should it happen that we don't run either of the two live, we will still give you access to the self-paced version of the course before the exam. So there's a lot of value, I think, that we are trying to put together for everyone. Zugani says, I'm registering, but I'm a member. How much do I need to pay? It's still the full cost. So we no longer have discounts for the diploma programs because they are quite intense. It's a 3 months program. The demands are very huge. We give demands. There's people who have registered for more than 2, and I see some of them are here. Then you know they negotiate with the team. But if you are registering for one, for considering the value you get, 3 months coaching and a whole lot of support. We no longer offer discounts for the diploma programs. Study material of obstetrics. Yeah, I think it's a book, but let me tell you the honest truth, because now I've seen how these things work. Now we are very experienced. Don't miss any coaching session. That should be your goal. If you attend every coaching session and you go through it and you engage with it, even if you forget to read the big Bible, yeah, obstetrics, I know that you will pass. That's the one thing I have seen. Don't miss any coaching session, even internal medicine. If you don't miss any, even me, I can tell you, if we go on theory, I will pass. It's just that I don't want to pass. Dr. Dere is happy to see that the 3 musketeers there. He says the winning team, awesome, Dokotelas. Yeah, this is us.
Yeah.
This is us. This is us. I want to see if I don't miss, because I do have 2 last questions from my side. I just want to make sure I don't miss anyone's question, and then we call it a night. Now, both of you referred to registrar posts and stuff. We know now, I mean, in my days, I don't know about your days. In my days, I didn't apply for any job. I was just placed. I could even stay there for 2 weeks and say, no, I don't like this hospital. Move me to Eastern Cape. You know, they would move me. Uh, but I hear that doctors now have to have CVs. They have to apply, and it's competitive. We are unemployed, etc., etc. Uh, what is the value really of these programs in terms of career projection and helping colleagues to stand out from the crowd? You know, let me start with you, Brother Ryan. Wow, you did yours. You know, if you have to have registrars, Do you consider these diplomas, or we are just doing them to look good on paper?
No, brother, one of the requirements when you go into a register post, because these are very, very competitive now. And whether doesn't matter which circuit you're entering, some of them actually stipulate you got to have your primaries, you got to have 6 months time, and rural time takes preference. And some of them even say you got to have your diploma. And even if the diploma is not a requirement, it shows that you invested in what you want to do, because you took the pain and the sacrifice to go and enroll in the program, prepare yourself, study, and show yourself approved. So definitely, diploma will stand you in good stead for a registrar post. But speaking from internal medicine, I'm sure with obstetrics, it's probably much the same.
Is it,
Yeah.
Billy?
No, it is. It is exactly like that. And I'll tell you, for me, what helped me to get the post is these diplomas that you mentioned. As the fact that I had an HIV diploma, I had, the obstetrics diploma, I had my primaries. I mean, the other candidates where they had been in the circuit, I always share the same story that, having the diploma actually gave me an advantage to getting the post. So, and I think it's even more important now that there's so limited posts. That's why, we encourage that all these diploma programs, people are so lucky that, the clinical care platform offering this support, because then you can easily get your diploma wherever you are, as many of as possible, get your primaries, because now we've got primaries programs, and then you actually stand a better chance than you would have if you had not, because it's tough these days.
Hey, Billy, tell us why they've added another year on the specialist, on the MED, whatever, FCP. I don't know, is it MED or FCP program? I know it's now 5 years, ne?
5 years, yeah. For the new candidates, it's gonna be 5 years. I think it's because there's that whole debate, obstetrics and gynae, it's double barrel, ne? Gynae itself is reproductive, which is a subspecialty on its own. There's oncology, there's urogynae, there's everything. Remember, for us in obs and gynae, as specialists, we're basically generalists in obs and gynae. So I can't say I'm an expert in oncology or urogynae. I'm like a GP in obs and gynae, essentially. So the gynae component is a huge qualification in itself. There's obstetrics medicine, there's fetal medicine. It's a huge thing on its own. So for one to be adequately trained for 4 years, the argument is that, and now there's also endoscopy as well, which I know Bobongi and them are doing so very well. So if you want to have someone who's well trained in endoscopy, in obstetrics, in gynae, 4 years is just not enough. So that's
Awesome.
why they added.
Yeah.
It's painful,
Yeah.
but I think it makes some sense. Yeah.
All right. No. Thank you. Now, there's always the next step, because there are colleagues here who have done these diplomas. Because I'm looking, I see them. They're like, okay, does it mean now I can't grow? Is this it? Am I done? Billy, you benchmarked part 1. Brother Ryan,
Yeah.
you benchmarked part 2. If I combine
Yeah.
both of you, I have part 1 and part 2. Basically, if you look at support from a clinical care platform perspective, we would have these regular webinar updates. We have master classes to help people to be competent in key areas of these disciplines. They write the diploma, but once you write the diploma, you are thinking, I can actually become the specialist. But maybe it's better to do my primaries, even maybe part 2 before I even become it. Because registrar time, as the last time I checked, especially for these two disciplines, obstetrics and internal medicine, I suspect it's not easy. So, what can we expect, Billy? Obstetrics post diploma? What can we expect? Or how was the
I think
experience here, part 1, as we close? Yeah, how was the experience here, part 1?
Yeah, the first cohort, it's always tough because you're starting afresh with everything, literally. But yeah, it was a good challenge, and we love good challenges. So it was very good. We've got some good feedback. Some of the colleagues passed, and we know exams are exams. Very subjective. But yeah, it was tough, but I think worth it.
Brother Ryan,
So,
part two. Yes, Billy.
no, I was just saying that after diploma, the next thing it's your part one, and hopefully soon we'll figure out the intermediates and then the part two.
So Pila in the sequence is intermediates first before part two.
For part two, yes, for us, yes.
That's the missing. Okay. We will get there. And who knows, very soon we will be that university. Online university.
I mean, at the rate that we're going, we are getting there.
Brother Ryan, how was your experience with the
Hey.
part two?
Yeah, it's a lot of hard work, brother. Won't lie, it's a lot of hard work. But on the platform, we have certified masterclass. There's 8 masterclasses, FCP2,
Yeah.
discipline driven,
Yeah.
cardiology, endocrine, VS. You guys know the deal.
Yeah.
So I'm actually working on a program for part ones. It's a lot of elbow grease because I did part ones in 2015. So
That's
a
10
long
years
time
ago.
So exactly.
Yeah.
So I'm trying to look at the most recent resources, trying to put it together, but it's a work in progress.
Yeah.
Watch this space.
Yeah.
Yeah.
Yeah. So colleagues, we grow every day and we are trying to do a lot. There's a lot of work we are trying to do in the background to try and make sure that we help you as much as we can in a reasonable way, in an accessible way. So also give us feedback when we share our surveys, because when the team shares the feedback, it will be based on those who responded. And I think it's going to be insightful. Firstly, I think they will be done by Wednesday, Brother Ryan and Billy. I'll send you the report. And then towards next week, we just call everyone and we celebrate the programs. And then we look at the feedback and we look at what it means for the cohorts that are starting. And then we take it from there. Just to look at... just few seconds. Exam timetable is now available. Exams in February, so we're going to have sessions until then. Karabo, we cover everything. Actually, if you look at the HIV diploma, we went up to 15 weeks. We cover everything. We cover all corners. Some of the things may not be in the exam, but because there's always new guidelines, sometimes we don't know. Especially in the HIV world, it's not a very stable program. There's new things every time. So we cover what we know, but we also need to cover, it's not about time, but we make sure that each system, like in internal medicine, is covered. In obstetrics, every sub program is covered. So you shouldn't worry about that. And then Mlibo says, let me put them there. Mlibo says, CCP has the exam that OPS paper has covered in 3 months. CCP has the exam that I don't know what it means, but we are doing our own mock exams now for all the disciplines.
Yeah.
That's a
Brother,
yes.
I think she means that the program was so beautiful and comprehensive. It's as if
Oh,
you already had the exams with you before it was actually carried out. That's how good the program was.
I can't see my gray hair. I wanted to remind you, colleagues, that I'm turning 50 and this new language of the young people, I can't grasp it.
Must become woke, brother. Become woke. Woke.
But let's asking an important question. Will the coaching, they are always recorded. You'll always have access. You'll get CPDs for every session. You will get certificates for every session. We are improving these programs. They are just getting better and better. The teaching, the instructors now, they have experience in teaching the content such that it's good, it's relevant. But the systems on our side as well, we are improving them. Every time I'm always thinking, how can I make it easy for people to access the resources without searching and those kinds of things. And you'll see even with this cohort, it's going to be a little bit different because we are trying to improve and make life very easy. Is a diploma essential if one has a part one? Remember, diploma for Billy, if I remember, diploma content is similar to your part two exam in obstetrics, at least.
Yeah, it actually, that's why it's so easy for us to do intermediates and part two, because it's literally what you do in the diploma.
Mm.
So part one, hey, I understand
Yeah,
what
boy.
Brother Ryan is saying that
Meiosis.
we think many years ago. Now we need to go back, and it's not something you
Hey,
want to do. So it's not an easy thing.
I
But the
was
diploma is,
listening there. Meiosis and remnant of the water. I think
hey,
this,
bruh,
that's why. That's why I can't go
hey.
back there. Brother Ryan,
Exactly.
what is the part two exam in internal medicine? The difference to the diploma?
Okay, it's a bit more intense.
Yeah.
It's like the diploma is like the baby,
Mm.
and the expectation from the part two is the big
Yeah.
mother.
Yeah. Yeah.
But similar content, yes, but a little bit
Yeah,
more
more
expectations. Yeah.
complicated. Yeah, but like a
Yes.
stepping
Yes.
stone, isn't it, towards that? But also, the
Correct.
diploma is a credential in addition to your final MMed. So it's always
Mm.
good when we come and we are not well, we see that we're like, okay, this one likes his work. May I please, if one needs to pursue dermatology, do we need internal medicine? Or there's no diploma in dermatology. If it was there, we would have long. With Makate, we're actually trying to register a diploma in dermatology, like with our own curriculum. So the only dermatology thing is in outside the country. Otherwise, we're gonna do the one done by the beauticians. What do you call aesthetic thing there, but there's no disease. It's more around how to make me younger. You can see I'm turning 50, so I don't think the colleagues can respond to this. Brother Ryan, do you know the relationship between the masters in dermatology and internal medicine? And probably the answer is no. You don't need to do internal medicine to do any MSc. Yeah, I don't know.
You
Yeah.
know, brother, like previously, like, for instance, disciplines like hematology and neurology, previously you had to do internal medicine time before you
Mm,
go into that. But
mm.
now these are recognized disciplines on their own.
On their own.
So,
Yeah.
and dermatology is one of those where you don't actually have to be internal medicine driven to get
To
there.
be a
So I'm
dermatologist.
not sure about the MSc. I don't know much about the MSc
Yeah.
program, brother.
Yeah.
Yeah.
It can be South African, but I'll check. As far as I know, in South Africa, maybe there's a university that has just launched it. Tell us more, Florin. As far as I know, there was no registered diploma in dermatology in the country. Yeah. Okay. Pre-hospital sepsis presentation will be appreciated. Okay, yeah, we will look into it. Just share with us via email. No, I wrote the exam. All questions were covered. Unbelievable. Where's the
Amen.
horn? We're about to finish. Yeah. Diploma is essential, very, very for day-to-day work. Yeah, very important because you, especially for a generalist like myself, you become very good at your chosen discipline. If you are a doctor with a special interest, both special interest, these are the Mawela type. Special interest in what? Forget the special interest. Show it by credential that you have a special interest. I think that is what we are heading to. When is the coaching session for internal med start? What is the cost? All the diplomas is the same price. It's 5,000 rands, and we start the official first week, yeah, October. So this week we'll be closing all the inductions and giving you login details, and we call a session on the survey, and we celebrate the launch and what people have achieved, and boom, we start. Because once we start, it's hectic. Oh Lord, I hope your registration becomes successful in dermatology. Yes, 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 yes. Jesus has already died for that diploma. It's here. We need to do the work. No one can stop it. Poo 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 poo. No more there. All right,
Hey,
colleagues. Yeah,
brother, can
remember,
I give you a joke to close? Can I give you a joke
please.
to close? Did you hear about the dermatologist who won the lottery?
uh
It turns out he spent the weekend on a tropical island. Just threw that one in there,
Colleagues, that's Brother Ryan. And I tell you, in the diploma, even the jokes, they are like, diploma type. Go part two, I order. They're like part two jokes. Dr. Magagula, your closing remarks?
Yeah, no, thanks, Celeste, for this opportunity, and yeah, looking forward to seeing you, colleagues, in a week's time. Yeah, otherwise, all the best.
Thank you. Brother Ryan, you're good.
Yeah, much the same, brother. Looking forward to seeing everybody. Thank you for taking the time for joining us. Rather quick one. I've
Yes.
noticed a big improvement as well in terms of the services from CCP, the beautiful, innovative new videos, those AI videos. The captions, everything is like dipping up a notch. We just appreciate you and the team as well. Thank you for everything you do. And yeah, God bless the diploma program. Looking forward to seeing everybody there.
I'm supposed to blush, but you know my skin color, I become too gray when I try to blush. So maybe let me. Yeah, reminding me of that. Colleagues, just to remind you that from the 1st of October, the clinical care platform will be a pure membership-based platform. You have to join membership to get many of our webinars and stuff. We want to bring great value to our members. We want to make sure that every question asked by our members is answered, undiluted. It's very important that those who trust us with their professional development, that we give them exceptional service. The things we've been trying that Dr. Ryan is talking about, you're gonna see these things becoming very consistent, because consistency compounds. We want to make sure that we offer great, awesome, reliable service to our members, access to micro lessons, everything that you deserve. We've been here, we are now turning 3 years, and there are specific people who, I mean, Dr. Ryan, there's someone like Dr. Matabani. There's no masterclass he doesn't
Yes.
support.
Yes.
And when he registers for 5 other people, 8 other people. He's a member of the platform himself. So, I really treasure people who commit to their professional development, but also who understand that to get value, there are trade-offs. Life, to grow, to achieve anything in life, anything worthwhile, it's uphill. And show me someone who has stopped growing, I'll show you someone who has stopped trading off. They want to have it all, TV and professional development. You can't have both. You have TV generations, Isidingo, or you grow. Isidingo or you grow. You can't have Isidingo and masterclass at the same time. So we are moving in that direction. We really want to do great things on the platform, and God has already blessed us. I think Gosi says, I'm a ComServe in internal medicine. I passed my part 1 this year. Would I qualify to write the diploma? For sure. You've got nothing to lose, Adenkosi. That's what I tell everyone. The college has requirements. I tell you, we'll give you our recommendation letter. Your line manager will give you a recommendation letter. They're going to see on paper you have part 1, you have committed to internal medicine. They will take you. We haven't had rejections, I can tell you that much, especially in internal medicine. You have nothing to lose, but you'll always come out very strong and a winner. Okay, let me stop preaching and say night, everyone. Till we meet again. I have shared the link for registration. Today is what day of the week? Yeah, we have a webinar. Oh, tomorrow, Dr. Magagula, we are hosting you on cervical cancer. It's during the day, 2 o'clock. It's a big event hosted by Gauteng, the legislature. Magagula is a politician now. And then on Thursday, we have something important on risk. That will be the first webinar in October exclusively for CCP members. Night. Thank you.
Welcome to today's information session in Diploma in Obstetrics and Gynecology and Internal Medicine preparatory programs. This session introduces 2 key preparatory programs developed to support medical officers and general practitioners in advancing their clinical skills. The Obstetrics and Gynecology program enhances knowledge and skills for safer maternal care. ACPD accredited advanced certificate is awarded upon completion. The internal medicine program supports postgraduate development with live webinars skills, case-based learning, and access to current clinical protocols. Both programs are tailored to the real-world needs of clinicians and aim to build practical, evidence-based competency. We look forward to sharing more about these opportunities and how they can support your professional development. Thank you for joining us. Let's get started